Breast cancer is a type of cancer that affects the breast tissue. It is important to diagnose breast cancer early to improve the chances of successful treatment. In this article, we will discuss the different methods used to diagnose breast cancer. 1. Breast self-examination. Breast self-examination, BSE, is a method for women to check their own breasts for lumps or changes in size, shape, or texture. BSE should be performed monthly, starting at age 20, and can help women become familiar with their breasts so that they can detect any changes. 2. Clinical breast examination. A clinical breast examination, CBE, is performed by a healthcare provider, such as a doctor or nurse practitioner. During the exam, the provider checks the breasts and surrounding tissue for any lumps or abnormalities. 3. Mammogram. A mammogram is an X-ray of the breast tissue. It is the most common screening test for breast cancer and can detect lumps that are too small to be felt. A mammogram is recommended for women over the age of 50 and for women with a family history of breast cancer. 4. Ultrasound. An ultrasound uses high-frequency sound waves to produce images of the breast tissue. It can be used to determine whether a lump is solid or fluid-filled. An ultrasound may be used in conjunction with a mammogram to provide a more complete evaluation. 5. Magnetic resonance imaging, MRI. An MRI uses a magnetic field and radio waves to produce detailed images of the breast tissue. It is used in conjunction with mammography to help diagnose breast cancer in women who have a high risk of developing the disease. 6. Biopsy. A biopsy involves removing a sample of breast tissue for examination under a microscope. There are several types of biopsy, including A. Fine needle aspiration biopsy. A thin needle is used to remove a small amount of tissue from the breast. B. Core needle biopsy. A larger needle is used to remove a sample of breast tissue. C. Surgical biopsy. A surgical procedure is performed to remove a larger sample of breast tissue. The biopsy sample is then examined by a pathologist to determine whether cancer is present. 7. Genetic testing. Genetic testing can be performed on individuals who have a family history of breast cancer to determine whether they have inherited a gene mutation that increases their risk of developing the disease. Genetic testing can also be performed on the tumor itself to help determine the best treatment options. Staging. Once breast cancer has been diagnosed, the next step is to determine the stage of the cancer. Staging is based on the size and location of the tumor, whether the cancer has spread to nearby lymph nodes, and whether the cancer has spread to other parts of the body. Staging helps determine the appropriate treatment options and provides a prognosis, outlook, for the disease. Conclusion. Breast cancer can be diagnosed through a variety of methods, including breast self-examination, clinical breast examination, mammography, ultrasound, MRI, biopsy, and genetic testing. Early detection is important for successful treatment of breast cancer. If you notice any changes in your breasts, or if you have a family history of breast cancer, talk to your healthcare provider about the best screening options for you.